Hello and good evening. This is Kuldeep Chaudhary from Health in India. I'm in the room of Head and Director of Neurology, Dr. Praveen Gupta. We are joined by a patient, Hunge Ramot, who'd come from Lagos, Nigeria. When they sent their reports, she actually came to India for a spine surgery. The diagnosis made back there in Lagos was cervical myelopathy. So she came here for a surgery to be done by Dr. Arun Saroz, the Chief Neurosurgeon at Artemis Health Institute in Gurgaon. The moment she was consulted with Dr. Saroha and he realized there's something amiss, so he reordered the MRI for the cervical spine, which showed that the spine was perfectly fine, but she was still having problems. That was the stage when Dr. Praveen Gupta, who's the busiest neurologist in the country, one of the top names, he joined the treatment team. He ordered an MRI of the brain, and the disease that was diagnosed was completely different from the original diagnosis. She was diagnosed with Parkinson and admitted to the hospital on the 20th of July. She was here for a week, during which the doctors tested the medicines and fixed the dosage, after which an intensive physiotherapy was done, and today on the 5th of August, just a day before they are about to fly back, Hunge is much better, and so we are trying to ask them about the experiences in India, and also to talk to the doctor about this disease, how frequent this is, and what is the prognosis. So good evening, Dr. Praveen. What I would like to know from you is what are the symptoms for Parkinson?
Parkinson's has 4 cardinal symptoms, which include slowness of movements. People become very slow, they are left behind while walking, they are left behind while eating. The second is imbalance while walking, they tend to fall or they are not as steady on their feet. The third symptom is stiffness of body. The fourth symptom is trembling. The symptoms of Parkinson's are asymmetrical, which means that they are present in one hand or leg earlier than the other hands or legs, and that is why they are frequently mistaken for focal problems like cervical discs or radiculopathy or myelopathy, as happened in this case. But once they are diagnosed, you give a small dose of medication for Parkinson and the symptoms start improving. So that's a test to know that whether you are on the correct diagnosis or not. Once you diagnose and you put people on medication, they respond beautifully, and as you can see with Ms. Hunge's case, and they are able to live a good quality of life for many years together. Parkinson's is known as an idiopathic Parkinson's disease, means it is a disease without a known cause. It is caused by degeneration of cells in a part called substantia nigra, which secretes dopamine. So Parkinson's is caused by deficiency of dopamine in the brain. Parkinson's initially should be managed with medications, because there are large amount of medications which will benefit patients, and the benefit will last up to 10 to 15 years. After 10 to 15 years, when the medicine is no longer benefiting the patient and the complication related to disease start occurring, that is the time to give the patient a new lease of life by doing the surgery. Okay. And we can give another 10 to 15 years of good life to the patient by doing that surgery. So we carefully select our patients to give them the best treatment in the least cost. Alzheimer's, there is a deficiency of acetylcholine in the brain, because the cells which secretes acetylcholine become degenerated because of the plaques. While in Parkinson's, the deficiency is because of dopamine. So the whole pathophysiology is different and the manifestations are different. Parkinson's is motor, physical, movement, stiffness, tremor. Alzheimer's is mental, memory, behavior, cognition, calculation, loss of basically brain's cognitive functions is what Alzheimer's is all about. There is a very specific type of exercise that you can do for Parkinson's to reduce your tone, to improve your stiffness, to improve your body balance, to decrease the tremor. So that physical therapy forms a very important component of treatment even in Parkinson's disease, but it's not the usual instrument-based physiotherapy. It is the set of exercises which the patient has to learn.
So sir, you came to India for a surgery, the diagnosis became completely different. What has been your experience about the quality of Indian healthcare?
Sincerely, we are very much impressed, because we already knew that by the time you get here, the whole test will be rerun. We knew that already. but we have had our mind fixed on surgery. So for us not to have it that no surgery will be managed by medication is a kind of miracle to us. That's the best way I can describe it. Well, naturally, you can't quantify health to an extent. But when you now quantify, you want to quantify the result I've got with what you have, the input, it's near zero. It's near zero. Quantifying the results I've got now with what you think you have paid, sincerely, it's near zero.
We are doing it for a large number of people who are being treated by us for headaches, dementia, depression, lack of sleep, and so many small things which can make life hell. They may not be as big as other diseases to require surgery, but they can make life very, very uncomfortable. So we can help a large number of people who are not being benefited in their own country by the available treatments there.
Thank you, Dr. Praveen. We are highly indebted. You spared time for us. More importantly, you have given a much better quality of life to our patient, Mrs. Honge. She'll carry fond memories of India, of Artemis Health Institute, and especially you as a doctor. We would like to thank your colleague also, Dr. Arun Saroha, for working as a team and managing this case. Thank you, Dr. Praveen.
Thank you.